Hi, I'm Andrew Bowden from Envision Optical. We're a locally owned private optometry business in 4 locations across the Gold Coast. And as part of my regular series trying to educate you about eyes, today I'm going to talk to you about one of the most common eye conditions, which is dry eyes. Now, dry eyes is a funny term because most people who have dry eyes have eyes that water. Dry eyes are actually just a term we use for problems with the tear film which coats the front of your eyes. It's a really crucial function with the tears to moisturise your eye surface. It helps you see clearly and it helps the cells on the surface of the eye stay healthy. So if there's anything disrupting the way the tears function, then you're going to have issues both with your vision and a lot of discomfort. And people that have chronic dry eyes can really feel like they've got scratchy, sandy eyes all day long, and it's an ongoing chronic battle to try and give you some symptomatic relief from that. So just looking at the little graphic here, the surface of the eye, there's actually 3 sets of glands which contribute to the production of the tears, and they have to be in just the right mix, otherwise you won't get the special lubricating effect. And then the tears run across the eye with blinking and whatnot and go down into the little tear ducts and down into our nose, and that's why you get a runny nose when you cry, because it's all linked in with a little drainage canal. But the tears themselves, if that mix and that chemistry isn't right, then you're going to have issues with not coating the surface of the eye, a lot of dry, scratchy eyes, red eyes, and particularly susceptible in air conditioning when you're concentrating on the computer and things like that, because we're not blinking as much. So we evaluate those using the microscope to look at the eyes and use special dyes and things to determine if there's particularly dry eye surface or whether it's an evaporative problem, and a number of different things. And then the treatments can vary a bit. Now the treatments, the key things to remember are when things are recommended to you is dry eyes is a chronic ongoing problem. It's not going to be a case of use drops for 3 days and it goes away. And there's a number of different types of eye drops, eye ointments and eye gels, which can be prescribed depending on how severe it is. You need to use them regularly every day. Usually most people aren't using them frequently enough because they put a drop in and think that didn't really do much. And I always tell people it's like moisturising this dry skin. You've got to continually do it to get things back on track, and then do a maintenance dose daily to keep things feeling comfortable and not have deterioration occurring. The other really important thing that can make a big difference is your diet, particularly omega-3 fatty acids like fish oil and flaxseed oil can make a huge difference to how comfortable you are, because part of the problem with the little glands that secrete the tears is different disorders that cause them to become inflamed, and the omega-3s will help with that. And there's been studies done where up to 70% of people on about 1,000 milligrams a day of the omega-3 dosage will get quite significant symptomatic relief within sort of 6 to 12 weeks of being on that dose. So that's really something that can be of huge benefit. There's a number of other things. There's eye sprays, little plugs we put in the tear duct to keep more tears on the eye. So there's a variety of different things, and really it's an individual prescription regime when you come in for an eye test, and we've worked out what's going on and what might work the best. And sometimes we have to change tack with the treatment. So dry eyes is kind of simple and really common, but there's a lot of complicated underlying things that can mean that it's not like a conjunctivitis, drops for 3 days, 5 days and it's all fixed. It's an ongoing problem, and for most people it's a problem that they're going to have for the rest of their life to some degree, and they need to learn to manage. Another unfortunate one for the ladies, and that tends to be much more common in females. So you know, if you're getting any sort of constant in and out, blink your vision and it comes better, scratchy eyes or anything like that, it could well be dry eyes, and really you should come in for a checkup. We can find out what's going on and prescribe the appropriate treatment. So I hope you found that useful.